two beautiful countries in the world, India and Australia. This is eCritCare podcast about evidence-based critical care medicine, helping you to save lives. Here are thoughts on controversies in critical care. And now, here are your hosts, Dr. Swapnil Pawar from Sydney and Dr. Jose Checo from India.
Welcome to eCritCare podcast. This is our episode number 98. And today I'm joined by my co-host, Dr. Jose Checo. Welcome, Dr. Checo.
Hi, Swapnil. Good evening. How have you been?
I'm good, thank you. Obviously, we are having now probably, fourth or fifth COVID wave. So we're just getting ready. Having said that, the ICU admissions are not that high, but clearly the hospital admissions and in community transmission is on the rise.
So for us too, we do have quite a bit of increased transmission and new cases in the last few weeks. But as you said, even we haven't been experiencing severe cases. Hospital admissions are indeed quite few, and hopefully the wave itself will subside over the next week or so.
Yeah, let's see. Today, we are going to discuss another interesting controversy, and that is around ventilator-associated pneumonia, or famously known as VAP. Now, it is one of the most frequent ICU-acquired infections, and the reported incidence varies depending on what definition you use, from like 5 to 40%. That also based on the setting and diagnostic criteria that we use. VAP is associated with prolonged duration of mechanical ventilation and ICU stay. And estimated attributable mortality of VAP is around 10%, with higher mortality rates among surgical ICU patients, and especially in patients with mid-range severity scores at admission. Now, one of the kind of interesting controversies around microbiological confirmation, although it is strongly encouraged, the sampling method, which method we should use and how to sample these secretions has been a matter of controversy. Having said that, now there are so many newly emerging microbiological tools are available at our disposal, so that probably the diagnosing and treating the VAP in the future might become easier. But also how long we should treat VAP and when to start treatment and when to stop treatment, that has also been the matter of controversy. So today we are going to dive deeper into this whole controversy, but just kind of a little bit of context about what's the burden of this condition. And if we use the kind of traditional definition of